All right, we will go ahead and get started. Again, welcome to today's first episode of State Policy Network's America's at its Best series. If you've joined us from your computer, you'll be able to type any questions you have for the duration of your time with us today into the Q&A option at the bottom of your screen. If you'd like to change your view, in the top right-hand corner, you'll see an option to change between gallery view and speaker view. Gallery view will present our speakers today like Brady Bunch style, as we call it, where you'll be able to see all of our speakers at the same time. Speaker view will show who is speaking on a larger screen on your computer. With that, I'll turn it over to Rebecca Painter to begin today's show. Thank you, everyone.
Thank you, Alyssa, and welcome. Thanks, everybody, for joining us here today. My name is Rebecca Painter, and I will be your host for today's show. As Alyssa said, we're calling our show America at its Best because I don't know about you guys, but every time I turn on the news, I'm a mixture of terrified and depressed. And I'm fortunate that I can turn the news off pretty quickly and get back into my home office and hear a lot of good news that's happening. And it occurred to us that since we're not able to come see you guys in your offices and in your homes like we're used to, we really miss that. And since we're not able to do that right now, we thought we owe you guys a weekly pick-me-up so you can hear what's going on across the country that's not being reported in the news. So I'm glad you guys are here today. You know, normally, if I were with one of y'all, we'd be sitting down chatting and you'd say, hey, Rebecca, what's new with you? So let me just go ahead and answer that question because I'm sure you're all wondering. Here's what's new with me. I do 3 things usually these days, not in this order. Number 1, I care for my baby who's going to be 1 on April 30th. So he's basically on my hip most of the time. And if you hear a squeal in the background, don't worry, he's just hanging out with his dad. Also, I work all the time because like you guys, I'm working from home all the time when I'm not taking care of the baby. And the third thing I'm trying to do is just rest my mind with some Netflix or some good books. And I'm struggling to find a show. I do not want to watch Tiger King, so please don't recommend that. But if you have a book or a show I should be watching, the 1 hour every 3 nights where I have time to do it, please type it into the Q&A section and Alyssa will get it to me because I'm really hungry for something to get my mind off all of this craziness. I'm coming to you guys from Columbia, South Carolina. Our governor issued shelter in place, just yesterday. But my life didn't change much because our mayor issued it about 3 weeks ago. So South Carolinians are in the same boat as many of you who are calling in right now. My first guest today is our CEO and president of State Policy Network, Miss Tracy Sharp. And Tracy is coming from California. Now, I remember, it was probably the very end of February. I called Tracy and said, we've got to go see some of our supporters. We're going to do it the middle of March. You know, are you good? And I remember her saying, I am, but I'm not sure you understand the hysteria in California that's about to come to the rest of the country. And I remember saying, well, I'm in South Carolina, you're in California. They're going to be 2 states more different. And she was right when she was talking about black market hand sanitizer and the crazy that was going on back then. So Tracy, what's it like in California today?
Well, first off, Rebecca, thank you for hosting this, and thanks to all of you for joining. We're doing okay here in California. I think we have flattened the curve to some degree, and I'm grateful that my family is healthy and safe. We do have our 2 college-age sons home with us, so that's different. So perhaps our biggest challenge right now is keeping food in the fridge and keeping them fed. But otherwise, we're doing okay, and we're gonna get through this.
Good. I'm glad your family's doing well. So what about this network? Because I know you've got your 2 boys, but this network has been your baby also for a long time. I think about crises that come up and impact the work that we do and things that have impacted me personally, right? So when 9/11 happened, I was in college. I was a sophomore in college. That was the first time in my life that my world got rocked. Now you're just a little bit older than I am, but I think you were here during that time. So how did this network respond to 9/11, and was there a lesson that was learned?
Sure. Yeah. 9/11 was a short, sharp shock, right? Where there's I remember a lot of fear in the weeks that followed. We ended up hosting our annual meeting less than a month after, and the network really pressed on after that.
Okay. Now, and then I guess the next big crisis to hit was, 08, 09, 10. And it's funny, I was talking to my husband about this just last night, and I said, I remember in 2008, I was in my first job out of college. I'd been out of college 4 years. I was making what I thought was good money, going out with my friends, having a good time. For me personally, being in my early 20s, it was a good time. And I said to my husband, what a difference a decade makes, because we are now feeling this in a whole new way, which again, that's just a little about me and my growing up, I guess. But what about this network and how we were impacted in those times? And is it the same as what this coronavirus is bringing?
Well, I do recall from the lessons from the Great Recession, which was more of the economic shock, really helped teach us here at SPN about how to prepare our organization internally to build up reserves, to build up a strong financial standing and position, and then go and teach and train that to the rest of the network. So the silver lining of the Great Recession is it gave us almost a decade to do that. Now I feel like the coronavirus is a little bit of both the economic shock and the sense of threat, both the 9/11 and the Great Recession. But I also feel like this network has been prepared and ready, that not just that we would be thriving as organizations to get through it, survive it, but to lean into the opportunity, right? To charge into the gap and really work with policymakers and governors to help show how market benefits can truly alleviate human suffering.
Yeah, well, you're right. And one thing that I remember has changed a lot since 08, 09 is that this network is ready. We're seeing that. I think 18 reforms in the last 3 weeks have been picked up by governors that were recommended out of this network in a variety of areas. I've never seen anything like it before. I've always had this frustration working in this world where everything feels urgent and important to me, and yet everybody else is going about their daily business and no one's rioting in the streets. I always thought that was so weird. Now that there's actually a crisis, people are paying attention. And part of me feels like I wish we could just go back to where we were before, because I know people were a lot happier. But on the other hand, there is some good that's coming out of this, and that this network seems to be positioned to help people and save people and save livelihoods, as I heard a friend of mine mention the other day. So do you agree? Do you think that we're ready for this moment?
I think we are. Certainly it is a new normal that is upon us, but we were really built for times like these, to lean into that, to build our relationships. So I'm really looking forward to hearing from the practitioners we have on the call today about what that looks like in action on the ground. SPN has been active in helping all of our network affiliates really lean into the opportunity, as well as shore up their financial positions. I think we're in a good spot.
Good. Thank you, Tracy. Well, that was a good opener for me to introduce my next two guests to our show. We've got Lindsey Killen from the Mackinac Center for Public Policy and Joe Layman, also from the Mackinac Center for Public Policy. Thanks for joining us today, guys. Now, Lindsey and Joe are coming to us from Michigan. And again, I told you guys at the beginning, I, for some reason, continue to watch like the first 10 minutes of the news highlights in the morning before I scurry back to my desk and get back to my happy place. But just this morning, I saw them talking about Michigan, like you guys are very close to surpassing New York in terms of the hardships that they're having there. And this is really serious stuff. People are getting really, really sick. This is affecting everybody. My brother is possibly going to get furloughed any day now. He's in the hotel industry. I've got a friend who just got tested for coronavirus a couple of days ago. It's touching everyone, but it's especially touching folks in Michigan. So, Lindsey, what is Mackinac Center doing about it?
No, you're right, Rebecca. It really is. It's a very serious situation. It's like that, of course, around the country, but in Michigan, it's escalated, especially over the last couple of weeks. We're now approaching about 20,000 cases in Michigan. We are rapidly those numbers are just growing rapidly. So it's important that groups like us, like ours around the country, are at the forefront of the discussions about what can be done, because of course, whenever there's opportunity to do proactive things, bad policy often results from that. And so it's been our our job to both, put out good policy recommendations that can have an immediate direct impact on the current crisis that are also going to be good policy down the road, and then educate policymakers as a part of those conversations about what not to do too. And so the Mackinac Center has done both of those things. And particularly, working with our governor here in Michigan, of course, for those
now
of
your
you
governor is a Democrat, right? Just want to make sure.
Exactly.
Okay.
Yes, she is. And so we have not been aligned on many issues during her short tenure thus far. But that said, I will compliment the fact that she has been very receptive to hearing what can be done from all sides, and particularly from the Mackinac Center, because I do believe there's a level of respect there for our 30+ year history of having sound solutions on pressing public policy issues. So we have been able to work with her administration, work with legislative leadership, and in rapid speed. And that's really key, I think, for groups like ours to have an impact. We have to know how to be nimble and adapt to ever-changing circumstances. So over the last 3 to 4 weeks, Mackinac put together a very short, concise list of healthcare specific policy reforms to start with. We ultimately then expanded to economic reforms as well as our conversations evolved. But to start with, we came to the administration, we went to legislative leadership, and we said, here's what you can do to have an immediate impact on the threats posed by COVID in Michigan. And about 48 hours after we began those conversations and provided our recommendations, the governor issued one of several solid executive orders that included essentially the entire Mackinac Center playbook.
Wow, that's awesome. So, for so long, I think that our network and just being in this world, we often talk about policies that people are considering, or there's a debate on the floor, and that's a victory because it's getting one step closer. This has accelerated everything. You're talking about within 48 hours, great ideas have been implemented. Now, when I talk about the fact that this network is actually doing things to save lives and livelihoods, this is real now. Can you tell us practically what came out of that executive order that's going to make a difference for people in Michigan as soon as it's implemented? And it has already been implemented, so this is happening as we speak.
Yes, she was very broad and incorporated not just our recommendations to a certain degree, or implemented elements of our recommendations, but we literally articulated to the administration and to the legislators how to implement the policy and what that policy should look like. And those policies are now in place via her executive orders. First and foremost, I think most significantly, she lifted certificate of need laws in Michigan, which have historically limited the availability of hospital beds, general hospital capacities and growth opportunities, the acquisition of critical equipment like CT, MRI, and PET scanners.
Does that impact ICUs across the country?
Yes, ICU units have been restricted under certificate of need laws. These are cronyist laws that have historically been really hard for groups in our movement to reform. In fact, no state has lifted their certificate of need laws since they were originally reformed at the federal level decades ago, at least in totality. And so for Governor Whitmer to take our recommendation to suspend certificate of need laws across the board in the state of Michigan for everything that they impact, and to do it so quickly is extremely significant, not just because of the immediate impact that has for patients in our state, but it sends a strong signal that this was probably bad policy to begin with. If this is your go-to answer in the state of crisis, we should never have had these policies on the book to begin with. So that's a very, very substantial development, and one we will definitely look to build on for permanent policy in Michigan for the remainder of this year's work at our legislature. But secondly, she also suspended restrictive regulations for licensed medical professionals, very far-reaching as well. Anyone from registered nurses to nurse practitioners, pharmacists, medical technicians, physician's assistants, medical students. all of the medical personnel in Michigan have had very restrictive licensing regulations lifted, and they've now been empowered to treat patients to the fullest extent of their skills and training, and without having to have onerous physician supervision. And they can also operate outside of the state. We can bring in professionals in the state. That's also a big development, something that's very hard to do typically outside of this sort of circumstance. So the reforms that she's incorporated in Michigan have already been a big help to those on the front lines. You know, my mom is a nurse, not here in Michigan, but I've heard from her in Tennessee that they're looking for that same type of relief because they have workers who are essentially being furloughed in some cases because they have not been authorized to treat COVID patients despite the fact that they have the skills that could allow them to do that. Government standing in the way. So that, you know, we're very proud of what we've done in Michigan, and it is our hope that while we're passing good policy, we're passing policy that actually impacts lives in very, very real ways.
Lindsey, do you know how many beds are going to make their way towards Michigan hospitals as a result of the Mackinac's efforts?
You know, really that impact is still to be determined, but we do know that prior to the COVID crisis, if Michigan had lifted its certificate of need laws, we would have had at least 4,000 more hospital beds in the state. And that's just, you know, minimally what we would have expected to see. So we already know that at least 4,000 more beds are going to be made available to patients that need them, but exponentially more than that as hospitals are acquiring new spaces to treat people.
Wow, that's incredible. So if you had the governor on the show right now with us and you could ask her to do one more thing that could really make a difference in people's lives, what would it be?
You know, my request to her would be, let's not take one step forward and two steps back. Let's make these policies permanent policy in Michigan so that we're better prepared for the next crisis when it does come, because it will certainly come. I mean, like you, I've lived through prior. I was there in 2008, 2009. I remember what that feels like. Obviously, not on the front lines treating ill patients, but our country does cyclically go through various levels of crises, and we don't want to be ill prepared for the next time around, nor do we want to have policies that we've at one time rolled back that have empowered healthcare providers, for example, in Michigan, to then suddenly impose them and to maybe even impose them again more arduously and set our state back so that we're even less prepared the next time we have to face something similar. So make these policies permanent would be my request to her.
Great, thank you. Now, Joe, let's turn it over to you. Joe, you were also around back in 08. You know, was the governor calling you and asking you for help back then, or has that changed a bit?
I do remember the governor then called us names, not necessarily called us on the phone, but yes, that's changed quite a lot. And I have been in the public policy business long enough now that this I can legitimately say is my fifth crisis. So it's not like they're all the same, but there are similarities, and this one is unique in many ways and worse in some. But the big change has been that we've had a great ability to influence a governor who we wouldn't normally be aligned with, as Lindsey said, because she's a Democrat. And that did not happen because it didn't happen accidentally. We realized a few years ago that Republicans would not be in charge in Michigan forever. And we intentionally set out to form stronger bonds with people we don't agree with on everything, but who we could agree with on some things. So we even found ways to partner with the ACLU, for example, perhaps the most surprising example on criminal justice reform and other things. We found ways to partner with this Democrat Governor Whitmer on auto insurance reform, which we've been working on for a long time. And it's fair to say she signed a better bill than our previous Republican governor might have signed. So it was having the having the relationships already in place when the crisis hit that allowed us to move at the moment that Milton Friedman predicted. Milton Friedman said, crisis only really, or policy only really changes when there's a crisis, a real one or a perceived one, and this one's real enough. And when the crisis occurs, the ideas, the policies that are put into place depend on the ideas that are lying around. Well, we made sure that it was Mackinac Center ideas lying around.
Great. So you mentioned having weathered a few other storms in your career. What do you think was the worst one up until this point?
The very different. I guess I'll just say the one that affected me the most and the longest was the loss of a key colleague, Joe Overton, our senior vice president, after whom the Overton window is named, as sort of a popular political theory that you all may have heard of. But Joe was killed in an accident after he left work one night, and he was only 43 years old, and he was a giant to us and to many in the movement. And so it just goes to show that you've got to be prepared for any kind of a crisis. Sometimes it can happen to one organization, sometimes it can happen to an entire globe, like this one. And it's at a time like this when it's great to have be part of the State Policy Network family.
No, I remember it must have been somewhere around 2007 or 2008. I just started working at a think tank in South Carolina, and the first thing the CEO did was send me to the Mackinac Center. And Larry Reed was there and Joe was there. And I remember hearing about the Overton window and the whole story about the plane crash. And that was a really important time for me personally, because you and Larry sat down, and as usual, I'm a curious person by nature, so I had a million questions for you guys. And you really set my career off in the right place. So if he were still alive today, and this is a question that just popped into my head as you were talking, what do you think he would make of this? You know, where the country is and what's happening right now?
I've thought of that myself. Joe was a very, very curious person, but also super insightful. And he would have seen some of this coming. He saw all of the social media stuff coming, although it didn't have a name then, but he innately understood we would be that connected and that it would change everything and that it would drastically lower the barriers to Mackinac and SPN getting the word out. He saw that the legacy media was in collapse and that vacuum would need to be filled. And so I can't say for sure what he would think or what he would say, but I know he would be immensely proud to look out at a constellation of organizations across the country that he had personal memory of the founding of dozens of those organizations that he saw get their start really with just one or two people and one or two donors. And now so many of us are in a position where governors and legislators are relying on us in a moment of need. I know he would be immensely proud of that. And then he would be saying, okay, this is good. When we get through with this, what's next?
Good. Well, and you know, that mentality, I think, shines through you as well, because from the first time I met you, you have this sense of urgency and purpose and passion about you that just shines through. And I've been wondering, for you in particular, Joe, you never slow down. I mean, it doesn't matter Corona, no Corona, it doesn't matter what day of the week it is or time of day, you are on a mission in Michigan and for the rest of the country. So how has this affected your sense of urgency? Can it go higher than it was, or are you just going as you always have been?
You see, I still have to prove to my wife, Karen, that I made the right decision 25 years ago to leave a perfectly good engineering job and get into the save the world business.
That's fair. Okay.
But no, she's a true believer and supported that all the way. But yeah, I do absolutely sense urgency. It is urgent. It all matters. But at the same time, I've learned that I personally have to You can't go 110% all the time. You will get physically stopped if you try to do that, and you'll drive everybody around you insane. And so the the remedy for us has been to grow a robust enough organization that it's not as if I'm the hub of the organization and everyone else has to be an extension of me somehow. Everybody's got their role. In fact, that's the reason Lindsey's on this call, my colleague Lindsey, because when you asked me to be on this show, I said, fine, I'll do it, but I don't really know all the details of what we have persuaded the governor to do. I'm going to need Lindsey to explain that. And that's, spread that across the organization. And that's how we've been able to manage a sense of urgency into building an institution that can act urgently when the situation requires it without burning any one individual out.
That makes sense. I think we can all learn from that no matter what industry we're in. Last question, Joe, I think, unless I think of another one as you answer this one. How has this changed Mackinac's vision and plans for 2020, through 2025? I'm assuming it has, but I didn't want to make any assumptions.
Well, I insisted that the Mackinac team put together a very neat list of 2020 legislative goals and policy goals. And ironically, when we got a very nice booklet on that back from the printer, it arrived about the time the state was shutting down due to the virus. And it was a good reminder of how priorities can change. So a lot of our policy agenda has to be delayed. And we've now shifted to a three-prong approach. And Lindsey covered the first prong very well, and that is just the immediate mitigation of the effects of the virus and the pandemic. Mm-hmm. That stuff is urgent. Lives are at stake now, and so we're working on that. The second thing that we're doing is we are saying some of these great changes, ideas of Lindsey and others that the governor has put into place, like eliminating the artificial restriction on hospital beds, let's just make that permanent. It was never a good idea when times were good. And it's a terrible idea now. And we need to make sure that people see that we need to lock in progress like that instead of going back to business as usual. And then lastly, we are getting the lights back on in Michigan, because I was talking to my friend Matt Briette in Pennsylvania about this. He's with the Commonwealth Foundation, and Matt observed that, look, this is not about essential businesses versus non-essential businesses. It ought to be about what can be done safely and what cannot be done safely. And anything we can do safely, let's go do. Because the people suffering economic harm right now, regular working men and women, even if they're perfectly healthy, they're suffering horrible economic harm. We're the very economy that has been yanked out from under them right now. We're going to need that economy to get them back on their feet as soon as possible. So that's our third prong, is working on getting the economy turned back on as quickly as possible.
Oh, thank you, Joe. Thank you, Lindsey. That's fantastic. I think you'll see across the network, as I've been talking with other organizations, there seem to be three core policy issues right now that everybody is jumping all over and talking to their governors. And it's the economy, first and foremost, healthcare, and of course, education. The Overton window, if you will, is definitely opening in the education space. So we'll be talking more about the economy in education in future episodes of the show. So thank you so much, Joe and Lindsey. I'd like to introduce our third guest, Russ Walker. Russ is a senior policy advisor with SPN. He also runs our healthcare working group. Now, for those of you who are saying healthcare working group, what the heck is that weird jargon? Here's how I like to think of it. We like to bring the best and brightest policy minds together in healthcare, and we have been for 7 years now, so that they can figure out some solutions to some of the most complicated problems facing the industry today. And I saw a really interesting stat that in all of 2019, something like 6 of the healthcare working groups reforms were adopted. And that was this big victory because it is hard to get 6 reforms adopted in what used to be the regular political climate. In the last 3 weeks alone, we're up to 10 that have passed. You know, again, I can't stress how interesting the shift has been, where all of a sudden governors, I don't care if you're a Democrat or Republican or something in between, they are calling and asking us for help. And it doesn't end there. It's all kinds of policymakers and influencers across the board. So I'd like to introduce you, Russ, to talk a little bit more about the healthcare working group. Tell us a little bit more about the impact you guys are making, you know, what you're seeing out there on the front lines with these best and brightest brains in the country. Russ, you're on mute though. This is us trying to do our show a new way. There you go.
There we go. Technology can be a challenge, you know, especially when you're working out of your home office. Yeah, it's exciting time. There's actually, you know, the pace of reform is happening so fast. We've seen reforms now in 18 states. 18,
not 10. I apologize. Yeah. I misspoke. Okay. Wow. It went up since 2 days ago. That's amazing.
It has. And it continues to go up daily as states are struggling to figure out how to meet this crisis that we're in. I think what's interesting, and Joe mentioned this, and so did Lindsey, we have these legacy protectionist policies in healthcare that are obstacles for patients receiving good healthcare. They've always been there. They've been there a very long time. And this is a moment when the healthcare industry is realizing, and physicians and politicians are all realizing these are bad policies, and it's time we need to change them immediately in order to meet the supply need of our patients. And all of these policies should have been removed, you know, decades ago. But it takes an event like this to really get politicians to recognize the protectionist aspects of these bad policies.
Russ, would you say it's fair to say that we've been talking about healthcare for the past 7+ years, but all the policymakers have wanted to talk about is health insurance, and this has finally flipped that switch, right? Is that how you guys are looking?
Yeah, the discussion in healthcare has been dominated for quite some time about health insurance, and it's the wrong discussion. It's really about how do we provide sufficient supply of healthcare for patients, how do we reduce costs to patients, how do we provide innovation, how do we allow the marketplace, open up the marketplace so innovation can occur. And these reforms aren't new. You know, we've been talking about them for a long time. A lot of them have been around a long time. Even this White House, we've worked very closely with the White House. We started working with this administration when they came into power in 2017. The White House adopted what's called the Choice and Competition Report, which has every single piece of reform that we're seeing occur in these states was adopted by the White House and put out in a paper about 16 months ago, and ignored by almost every state. And the White House said,
those ideas originated from your working group.
They did. We worked very closely with the White House, with their staff, their domestic policy staff, to feed them ideas. And this administration has been great because they see the states as the place where these sorts of reforms should occur, not the federal government. And that's very important.
That's huge. Now tell me, let me interrupt you for a second, because I keep, I always see these long, kind of, no offense to anybody, but wonky policy reform lists. And I have to like get out my encyclopedia and look them up, or just Google them. But let me just run you through a couple things that get on my nerves about the healthcare system. And you just let me know if these are the kinds of things you're talking about. All right. So I mentioned to you guys, and I heard him crying a couple minutes ago, that I've got an 11-month-old at home. I'm very fiscally conservative. Or people call me cheap, whatever you want to call it. But I called everybody who needed a phone call before I had the baby to make sure I knew exactly how much it would cost. And I had saved up and I was ready to go. I got my very big bill. I paid it like a good person in full and moved on with my life. 2 months later, I got another bill. And I thought, well, this is weird because it's just as much as the first one. I already paid this. And when I called, I heard them, they literally said to me, oh no, Mrs. Painter, that was the bill for your hospital stay. This is the bill for your baby stay. To which I replied, I'm sorry, was my baby at the Ritz? And I didn't know because I thought we were like at the Motel 6. All right. That surprise billing is criminal and it happens to everyone. So what are you doing about that? Is that part of your reforms?
It is. And, one of the challenges we had when we were looking at what could be done now was, these governor staffs, and the governors themselves, they're all drinking from a fire hose. There's a lot coming at them. It's coming at them very quickly. There's the press is hitting them hard about why didn't you do something sooner? So we have very little time as policy experts to talk to them about what needs to occur. So we looked at all of the different healthcare reforms that could be implemented that would help patients with access and help physicians to protect physicians from cross-contamination and also patients. And we came up with 5. Surprise billing was one of those 5 reforms.
Good, thank you.
Yeah, we came up with 5 reforms that would have the greatest impact. And surprise billing made the list. It's difficult, but it's important because when people go to the hospital and they're forced into this hospital system because they have something like the coronavirus, they have very little choice. They have very little discussion about how they're going to be treated. It just has to be done. And so on the backside, to get a bill for $10,000, $15,000, $20,000 out of nowhere is, it's really quite criminal. But so we're asking, one of the things we're asking governors to do is to put just a freeze on surprise billing. The bigger reform, which was really worked up by OCPA in Oklahoma, one of the think tanks in the network, is surprise billing reform, and it's combined with transparency. It just takes a little bit of time to put it in place and to give hospitals and healthcare networks a chance to deal with the transparency side.
What are some of the others that are on your list of 5?
Yeah, the other 4 are a certificate of need reform, which Lindsey talked about earlier. This is really critical. This is probably the biggest piece of reform and the worst protectionist policy that exists out there, and the worst legacy policy that exists out there. Telehealth, which is really innovative. It protects patients and physicians. It allows patients to be seen, over, by telephone or over the computer, and to receive prescriptions and things like that. A certificate of need, licensing reform, which would allow, things like state reciprocity. The interesting thing about licensing reform, I'll tell you this quick story. There was this great photograph, and most of the people on this call have probably seen it. And it's a Southwest flight, and it's full of doctors and nurses going to New York. And it was a photograph that was part of an article, and I can't remember who published the article. And the photograph was lifted and shared online and went viral. And it's a great photograph. And it celebrates kind of this generosity we have in our society, but it would not be possible under the current laws if they hadn't been changed. There is no way you would have been able to put those physicians and those nurses on that plane and flown them to New York to help the New York crisis without redoing all the licensing laws in New York. And the governor waived them all. That's what the governor did. He waived them all. He waived all the con laws. And so we celebrate these things that seem so common sense, but yet until 3 weeks ago, were impossible or virtually impossible for us to get done. And they're making a huge difference in delivering care in critical areas. The last piece was scope of practice, just allowing physicians and healthcare professionals to practice at the top of their licensing.
Okay. Was there anything that didn't make that list of 5 that if you could squeeze one more thing in, you think it would make a big difference?
There probably are. I mean, I would think pharmaceutical pricing reforms would be one of them that a lot of people would love to have seen part of that. I'm sure Lindsey's got a list. But
I'm sure that's the next wave.
It is.
Okay. I get kind of greedy. You guys give me a little bit and I'll take a mile. All right, I guess here's my final question for you, Russ. Let's say it's the year 2025. We've gotten through coronavirus, and this network has succeeded in making many of these reforms stay for the long term, because I know Joe and Lindsey and you've been talking a lot about this with the working group. It's not just about this flash in the pan of right now. We definitely want to help people now, but we've got to make sure that these things stick, because I don't know how anyone can go back to the certificate of need. By the way, before I even ask this question, who is the special interest there? I'm not seeing the connection. It's so bizarre to me. Can anyone answer that quickly?
Hospitals. It's a hospital, if they own the market, I live in Salem, Oregon. There's one hospital in Salem, Oregon. It does not want competition. It really doesn't. And I've got friends that work at that hospital. It's a good hospital. 2 of my kids were born there, but it does not want competition. And so the biggest obstacle to certificate of need reform around the country is always hospitals.
Right, to get the certificate of need to build a hospital, but to get a bed just seems nuts to me.
Yeah, well, they don't want, for another great example is, Target's been wanting to put, nurse practitioners in Targets and let them, see people and write prescriptions for common colds. We can't get things like that typically because the physicians associations oppose them. They want only physicians writing prescriptions. They don't want you to be able to go to a Target and get a prescription or be seen for a cold or a flu, a simple flu. These sound like really simple things, but they are the special interest entrenchment in this country is deep, and especially when you get in these states. And some of these interests, like the nurses and the physicians and the hospitals, are very powerful interests in most states.
How are you guys, the working group, and Lindsey, you feel free to jump in too. I mean, is there a special secret sauce you have ready to keep these things for the long term? I have a feeling that's still being worked out every second of every day, but it'll be easier, but I know it's still not a slam dunk.
Yeah. I'll just say this, you might hear some hammers in the background. We're doing some work at the house during this crisis. We're doing some remodeling. I had a contractor in my house last week, and I told this story to the healthcare working group. We were talking, and he asked what I was working on. He's someone I've known for a long time. And I told him, and he says, well, you know what? He says, I've seen my doctor. He has gout, of all things. I felt so bad for this guy. He has gout, and he says, I've seen my doctor 3 times through telemedicine in the last 3 weeks. And he says, I love it. He said, I've never been able to do this before, but now since this whole Corona thing's happened, I can do this. So I think one of the ways we're going to make these things permanent is people are going to experience the convenience of telehealth. They're going to experience going to a PA, and the bill's going to be different than the bill than when they go in and they wait in the doctor's office and they got to see the doctor through the traditional means and go into the clinic. And they're going to start feeling how this is different. And part of what creates the change and allows us to really get the innovation that's been out there is when people realize how different the world can be. And that's one of the real positive silver linings in this crisis, is that people are realizing how different the healthcare world can be if only government got out of the way.
Well, and it's also easier. We all know it's easier to provide something than it is to take it away. And so now that we have all of these great policies being implemented via executive order or sort of emergency action, the legislatures, it's going to be harder, as Russ said, once people have a taste of, broader access, higher quality, more convenient healthcare. And they know that the sky doesn't fall as well. We know that by lifting these things, people we have better patient outcomes, not poorer patient outcomes. And oh, by the way, 30 some other states have lifted these sorts of policies at various times permanently to no serious consequence other than, better patient outcomes. People are going to realize that they like what they get, and it's harder for government to take a benefit away than it is to get it passed. So now that these are out there, the responsibility, the hard work is going to have to be on them to try to make the case now that suddenly, because the crisis has dissipated, that these bad policies should be put back into place. We have the better ground to fight on because right now they've been repealed. And it's easier to defend that than it is for them to fight back and carve back turf that they've ceded.
Well, that's very well said. Well, my final question was going to be really for any of you guys who want to jump in and answer this question. So let's say it's the year 2025 and we've gotten through the coronavirus. Exactly what Lindsey and Russ just said has happened. People actually enjoy this new health care system. And again, as I mentioned earlier, we will be talking more about the economy and education, among other issues. So things have changed. What do you guys see in terms of opportunity for this network and what this network will look like by 2025, assuming things start to move more in our direction in a way they never have before. Anybody want to jump in and take that one?
I'll just say on healthcare, I think the debate has changed, and I think it's permanently. I think there's going to be some permanence to this change. I think we'll talk about healthcare differently than we've talked about it for the last 10 to 20 years, and it will provide us with a great deal of opportunity to talk about the supply side of healthcare and providing access and affordability. Right now, we're not emphasizing affordability, but it's a big piece of this. Instead, we're emphasizing, the security and the healthcare outcomes of these reforms. But also, it's interesting the dynamic it's having in DC, because there is, and I did want to mention this, it's changed the way people look at the FDA. The FDA has been a massive roadblock to healthcare innovation because they approve all the new technologies. It's been a massive roadblock to things like how medicine's used. And people are beginning to recognize it for the first time. And it's getting out into the general public that the FDA is a roadblock, and not just the FDA, but the CDC can be a roadblock at times. Yeah. Oh, yeah. And so that change, the fact that the general public is now realizing this, is going to make a big difference. It's going to make it much easier for us to talk about healthcare and move the needle on healthcare in a way we haven't been able to do for the last 20 years. It's all been dominated by discussion about insurance.
Yeah.
I would say two areas come to mind. Both of them are areas that are whose business models are now struggling or failing, and this will accelerate that trend. One is in education, particularly higher education. This is a personal prediction. Anybody who thinks that college is going to resume as normal in the fall, I think they're just about delusional. It's not going to happen, even if the virus is considered under control at that time. Too many parents will be saying, "Where's my refund from last semester?" Too many parents will say, "I could afford it last year, I can't afford it this year." Too many parents will say, "The online worked okay," and the kids will want to go back, but a lot of parents are still going to have a say, and so this is going to. A lot is going to shake out from that, and some version, I think, of that will also shake out of K-12. The second area is this will open up wide new opportunities to fill information gaps in our society because of the accelerating collapse of the legacy media. There's going to be some bad actors enter the space, but as we as policy institutes can demonstrate our credibility, our voices will become relatively more important.
Thanks, Joe. Okay, so I'd like to turn it over to Victoria on our team, who is fielding questions. If you guys have any questions, now's the time to ask them. Victoria, do you have any questions so far?
We do have a question from Carrie in Virginia, and Carrie asks, Lindsey mentioned keeping good policies. What about getting rid of the bad policies? And what are we doing to dial back on bad policies?
Great question. Who wants to take it?
Well, I can start. As I mentioned, when Mackinac approached the governor and when we approached legislative leadership with our recommendations for what they could do immediately, we didn't just approach them with the "here's what you should do" list. We approached them with the "here's what you shouldn't do" list as well, because we know that as we're talking to them, they're getting talked to from all different sides of the political spectrum. People are feeding solutions rapidly, as Russ says, they're drinking out of a fire hose. And so particularly because our governor in Michigan demonstrated such an openness to a variety of solutions, we knew that probably meant she's also open to some pretty bad ones too. And so we were very proactive on that front. I know a lot of other SPN allies of ours across the country have done that same thing. And in fact, Mackinac has provided our don'ts list as much as we've provided our do's list. But that is very much a part of the conversation. They work in tandem. Like I said earlier, we don't want to take one step forward and two steps back. We're not going to be satisfied if we get one good policy or a handful of good policies in place only to see the ground crumble beneath it, because so many bad ones were also adopted at the same time. And I think what makes us so successful as solution shops is that we can be very forward thinking too, and what can happen if bad policies are adopted, even versus no policy at all. Sometimes action in a step in the wrong direction is worse than no step at all. And so we're having those conversations all at the same time. And I know that's true for groups across our network.
Yeah, I'll just, if I can just add one thing. I think you saw, I don't know how many of you know this, but Bernie pulled out of the presidential today. And in his speech, he talked about how none of this would have happened if we had a single payer healthcare system. And so, you know, this is just to reinforce Lindsey's statement. We're going to face this, and we're going to be fighting, you know, the run towards single payer. It's going to continue to be a fight. And that's why we have to remain engaged, and we have to remain diligent and really push as much information as we can about our reforms. And, you know, these five reforms that we're suggesting to governors right now are just really the start. There's a whole lot more that we can ask of them in the future to improve markets and improve accessibility to healthcare and innovation.
And, you know, Russ, we also, we drafted a model resolution that we circulated with the healthcare working group that then ultimately got circulated to SPN groups nationwide, which is a perfect example of how to make sure that bad policies aren't enacted by bureaucrats, by providers, or by heads of government. But that model policy is a result of conversations we were hearing about hospitals getting together around the country and colluding on a preemptive policy where they would refuse potentially life-saving protocols to COVID patients who might code at hospitals, regardless of age, regardless of the situation. It would be a blanket presumptive policy that they would adopt. And that's inhumane. I mean, that's just unheard of in a country like ours. And so we at the Mackinac Center heard about this, and within the same day had drafted a model resolution saying, not in our state. And then we sent that around to our friends and allies around the country. And coincidentally, it also made its way up to the federal government, who just 2 days later gave us a call, said, thank you for doing that. And you know, we're going to issue a bulletin on this. And they issued a bulletin from the Department of HHS's Office of Civil Rights denouncing that type of action should the hospitals take it, and incorporating a lot of the language we use in our model resolution, which has since been adopted in California and Pennsylvania, and on the table in a handful of other states as well. But when we hear about bad policy, we're just as proactive as we are when we hear about opportunities to pass good ones.
Yeah.
Lindsey, your example just really hits home. We were talking about 9/11 and 2008. It just shows the growth and influence of this network over the years, because the White House has been calling folks within our network, you know, not just on healthcare, but also on education and the economy and a variety of other issues. You know, it's the federal level is seeking input from the states. And at the same time, your story just shows how Mackinac caught something and you guys alerted everybody else in the network so that other states understood that this was coming to them and they could fight it too. It's really amazing to me how strong we all are when we're working together. Everything's different in each state, but the way things accelerate quickly because of the way you guys work together within this network is just, it's been amazing, especially recently. So thank you.
And I would add, Rebecca, that the most successful organizations are those that can adapt quickly. And Lindsey's example was just that. They saw the need, they adapted, they addressed it, and then they got the info out to the rest of the network. So it shows the power of network effects. When we work together, these things can be accelerated to stop bad policy, but also to put forth good policy.
Yeah, you know, this has been a really stressful time for everyone on some level. There have also been really good things that have happened, especially, you know, that I've gotten out of the last 3 weeks, but it's stressful no matter how you're being touched by it, even if you're just stressed out because you have to be in your house all the time. it is hard, but I'll tell you, I've never felt more passion around the work that we're doing. This network truly was built for this moment. This network has always come up with solutions to some of the biggest problems facing our country. The difference between today and 3 weeks ago is that so many people are hungry for those solutions and they're taking them and implementing them, and that is going to continue. And that is the Overton window at its finest hour, and we're ready for it. So I just want to thank everyone who joined our call today. I want you guys to know that this was a test. I know this show wasn't perfect. I call it a call, I call it a show. I'm trying to make it a show for you. We really just miss talking and seeing you in person. And I know this isn't a super deep dive into any one policy area, and you're not hearing any grand master plans to do anything. And one thing in particular, really just wanted to come and share some good news. We do want to hear from you if you've got insights and feedback on the work that Mackinac is doing, which again, doesn't just start and end in Michigan. The work Mackinac is doing is exploding all over the country and other states because they're connected to our network through the healthcare working group that Russ is involved with. But if you got questions or insights about that stuff, we want to hear from you. If there's something else you want to hear about on this show, let us know. We had a couple of emails from a few of you and really appreciate it, where you really are asking some tough questions about the economy and did some governors go too far? It does seem like a lot of folks are avoiding this topic of conversation, and it's one we need to have. So we're putting a show together around that, possibly for next week. I'll know more in the next few hours, but keep an eye out in your email, and we'll be in touch about that. At the end of the day, none of this would be possible without you. I mean, you guys make all of this possible, and thanks to you, we're in a position right now of strength where we can come in and help people, and hopefully make some changes that are long lasting and permanent, which is what you guys have all been working towards with us for years and years and years. So light in all of this is that, hey, we're here, we're getting stuff done, and we're not going anywhere thanks to you guys. So thank you, everyone, and we hope to see you next week.
Thank you. Take care.